dear students, welcome back to the GDC classes. So dear students, today we are here with an important video, that is MRB Pharmacist Tamilnadu Master Stroke series, and in the today's video we are going to take the question from the important question from the pharmacotherapeutics. And under the pharmacotherapeutics, these are questions mainly from the introduction portion, CVS, as well as from the respiratory. So if you are preparing for the MRB Pharmacist, then definitely watch these videos. This series will be the very important for all of you at the time of the examination. So you all must understand each and every question. It will definitely provide you the clear-cut concept regarding all the topics. So in this today videos, we are going to cover firstly the introduction, scope and objective of the pharmacotherapeutics, cardiovascular system as well as the respiratory system. So what is the first question? Here is application of pharmacological information together with the knowledge of disease for its prevention, mitigation or cure. Simply, what is the name? Pharmacotherapeutic means pharmacotherapeutics means this is a branch of pharmacology which deals with the art and science of the treatment of disease. That means we applicate the use of the medicine in the disease for their diagnosis, for their prevention, for their treatment. So simple here is knowledge of disease for its prevention means application of the drug information with the knowledge of disease for prevention, mitigation, cure or the diagnosis of disease. That is called as the pharmacotherapeutic as its classification or as its definition, art and science of the treatment of disease or information of drug in which we use the knowledge of disease and we applicate that drug for the treatment of any disease. So pharmacotherapeutic refers to the use of drug to prevent or diagnose disease as well as to alter the normal function. Pharmacotherapeutic correlate pharmacokinetic, pharmacodynamic. This is the application of the pharmacological information together. Here is the pharmacokinetic also. Here should be the pharmacodynamic also. Here dose, their relation, their function, everything will be there. How many drugs are present in NLEM 2022? What is the meaning of NLEM? National List of Essential Medicine. So firstly we have to understand what is the essential medicine. Essential medicine are those medicine which is needed by the majority of the population. Correct? Now these essential medicine, first time WHO have given their first essential list in 1996. And according to that, they have supervised all the countries, please form your own essential list. That will be named as the National List of Essential Medicine. When the first time it was started in 1996, at that time there will be the 279 total medicine included under the essential list, means the drug which is needed by the majority of the population. And consecutively after the 2 years, it modified according to the list of the WHO model list. So in 2022, by the newer recommendation, nowadays total 384 medicine, or we can say the single medicine has put it in the National List of Essential Medicine 2022 list. Previous it was the 376, in which there was some drug which is removed, that is 26 medicine has been removed from in the 2022, while 34 new medication has been added. So total it become the 384 compared to the 2015 in which there was the 376 medicine were added. So there was the different types each and every year. Some drugs introduced in the market, some drug banned from the market. So this list modify after 2 years. If you are preparing for the MRB Pharmacist, then GDC have started the free test series for all of you. What you have to do, simply just download the GDC classes app from the Play Store, visit into the batches section and click on the plus button. After that, it will ask to enter the batch code and the batch code is MRB25. After this addition, you will get free test series, solve the question improve your preparation day by day. Here is the picturization. You can find out. Install the GDC classes app. Here batches section plus sign, enter batch code MRB25. Next question. Full form of NLEM, National List of Essential Medicine. Simple answer. National List of Essential Medicine. Yes. Ministry of Health and Family Welfare publishes National List of Essential Medicine every alternative 2 year. Which is the scope of pharmacotherapeutic? Pharmacotherapeutic. Treatment, mitigation, cure, prevention, diagnosis, each and everything. So disease treatment, prevention of disease, individualized treatment, all of these. So correct answer will be the all of these. Yes, these all are the scope of the pharmacotherapeutic, because here we treat the disease also, mitigate, cure, diagnose, prevent, everything we followed under the pharmacotherapeutics. What are the advantages of standard treatment guidelines? STZ in short, full name, Standard Treatment Guidelines. This is the basic guidelines which is given by under the pharmacotherapeutic, which means during the treatment of any disease, we have to follow some standard procedure or standard guidelines. What? There should be proper diagnosis. There should be consistency in their treatment, as well as the medicine should be the cost effective, and variance means any type of the discrimination cannot be carried out during the treatment. So here consistency in care, reduce variation in practice, cost effective care should be there. So yes, here is also the right answer is all of these. So advantage of the standard treatment guidelines. During the standard treatment guidelines, we have to follow the consistency in care, quality improvement always should be there, cost effective care, reduce variance in practice, improved patient safety, research and data collection, all these things should be carried out under the STG. How many medication are concluded in the first National List of Essential Medicine in India? First means in the 1996. And in the 1996, the first list which was published, that have the 279 medication at that time in 1996. The first National List of Essential Medicine was published under the Ministry of Health and Family Welfare. First National List of Essential Medicine included 279 medication, which describe the cause of disease. Always we say, what is the cause of disease, or what is the etiology of disease? So cause, etiology have the same meaning. These are the synonyms. So cause, etiology describe the cause of the disease. So correct answer will be the etiology. Pathogenesis means what are the different conditions or different type of the symptoms which is originated. Pathogenesis. Pharmacology, the drug study. Pharmacotherapeutic, art and science of the treatment of disease. So pathogenesis, it is the process by which a disease or disorder develop. Cause, etiology. Suppose there are some disease which is caused by the virus, which is caused by the bacteria, which is caused by the infected water and food. So cause will be the different. Pathogenesis, development process of any disease. That is the pathogenesis. Full form of STZ. Standard Treatment Guidelines. Yes, Standard Treatment Guidelines, where we have to follow some types of the basic phenomena under the pharmacotherapeutic, that is called as the STZ. Prescribing Guidelines, all the things we have already studied. India developed its first National List of Essential Medicine in 1996. Recently we have gone through the, yes, in 1996, first National List of Essential Medicine has been published, which included the 279 medication. Full form of EML, yes, now it's called as the National List of Essential Medicine, but previously it was known as the Essential Medicine List. So previously it was known as the Essential Medicine List, means EML. Now it's known as the National List of Essential Medicine, NLEM. You have to remember both. List of drug deemed essential for meeting a population health need is known as the essential medicine. So dear students, here GDC have launched the MRB Pharmacist theory book as well as the MRB Pharmacist objective book, which is totally on the basis of pattern of the MRB Pharmacist examination. So go and grab this opportunity. Both books are available in the GDC classes app as well as these books are available in Flipkart and Amazon. You can order it and yes, you can improve your preparation very easily and you can get selection. Next, what drugs are used in the treatment of myocardial infarction? Myocardial infarction, also known as the heart attack. Heart attack, myocardial infarction, what happened actually there? In there, the blood vessels, either there is the formation of the atherosclerosis, less blood supply, myocardial ischemic condition will be there, and myocardial infarction or heart attack will be there. So for that, we have to use the sympathetic sympatholytic drugs as well as calcium channel blocker, RAS system drug. These are used in there. So calcium channel blocker, angiotensin receptor blocker, ACE inhibitor, yes, all of these drug can be used. Calcium channel blocker, yes, dipine class drug, dihydropyridine class drug means nifedipine, amlodipine, nicardipine, as well as benzothiazepine, diltiazem, as well as the phenylalkylamine, verapamil drug. Under the angiotensin receptor blocker, all the sartan class drug, that valsartan, condesartan, irbesartan, telmisartan. ACE inhibitor means pril class drug, that means captopril, lisinopril, enalapril, ramipril, prindopril. All the pril drug comes under the ACE inhibitor. So all these classes, nitrate, statin, calcium channel blocker, ACE inhibitor, ARB, beta blocker, aldosterone antagonist, antiarrhythmic drug, all these drugs can be used in myocardial infarction. Angina is also called as angina pectoris, and angina pectoris is mainly two types: classical angina, variant angina. Classical angina mainly happens at the time of the exercise, emotional situation, something like that, while variant angina can be happen at the time of the rest and sleep. So variant angina is more dangerous as compared to the classical angina, because classical angina is predictable but variant angina is non-predictable. In the classical angina, yes, the drug can be nitrate or it can be used at that time. What mainly have atheroma, vasospasm. Remember the word. Okay, so it is also known as the angina pectoris, where the imbalance between oxygen supply and demand occurs. That is called as the angina pectoris, in which pain on the left side of the chest happens. Angina is symptoms of the coronary artery disease. Angina pectoris, imbalance between oxygen supply and demand. Myocardial infarction is also known as the heart attack. Yes, heart failure is different. That is the congestive heart failure, CHF, CCF. But myocardial infarction is also known as the, commonly called as the heart attack, where the damage or dies due to the lack of the blood supply to the heart muscles. What is the range of the systolic blood pressure and diastolic blood pressure in pre-hypertension? But firstly, we have to remember what is the normal systolic and diastolic blood pressure. So 120 by 80 mmHg, that is the normal. After normal, we have the pre-hypertension. From the 130 to 139 systolic, 80 to 89 that is diastolic. So here what is we have? 130 to 139 systolic blood pressure or 85 to 89 diastolic blood pressure. These are the situation of the pre-hypertension. After that, 140 to 159, 90 to 99, that is the hypertension stage 1. Then we have the 160. This is the hypertension stage 1. This is the hypertension stage 2. What we have the answer for the pre-hypertension here? Normal 120 by 80 mmHg. Pre-hypertension 130, 139, 85, 89. Grade 1 hypertension 140 to 159 or 90 to 99. Grade 2 160 to 179. Grade 3 more than 180, that is the grade 3 hypertension. So these are literally very much high blood pressure or we can say the hypertension. The heart attack occurs when there is the blood clotting in. Obviously, where? Coronary artery disease. if there is the blockage in the coronary artery, then there is the less chances of the oxygen or blood supply to the heart muscles. So there will be the, that will condition mainly, that blood flow mainly flow through the coronary arteries. So when there is the blockage in the coronary arteries, then less blood supply to the or heart muscles. That's why it is called as the blockage in the coronary artery. These are the blood vessels. These are the blood vessels which represent as a coronary artery. The meaning of myocardial infarction is irrevocable death of. The meaning of myocardial infarction. Obviously, heart muscles. When heart muscles dies due to the lack of oxygen, blood or the blood supply, then that is called as the, that is due to the death or damage of the heart muscles. So myocardial infarction, commonly known as the heart attack, mainly through the heart muscles, myocardial infarction. Yes. Symptoms of angina: chest pain. Yes. Squeezing on chest, shoulder pain. Yes. Initially there is a chest pain. Then it's moved toward the left side in hand, shoulder, neck, jaw. It can be also there. Squeezing on chest means there is some types of the squeezing situation is there. So yes, there will be the, all of these condition will be there. These are the different symptoms of the angina: chest pain, discomfort, stress, squeezing on chest, burning on the shoulder pain, breathlessness. These are the situation of the angina pectoris. Which of the following is a risk factor for the hypertension? Hypertension. Regular physical activity? No, this is not a risk of the hypertension. Low sodium diet? That's good condition. It's also not a risk of the hypertension. Family history of hypertension? Yes, it can be. Normal body weight? No. So, family, if any person have the family history hypertension, then maybe there is the chances of that their offspring or their next generation will also have the hypertension. So yes, risk factor for hypertension is family history, obesity, lack of exercise, tobacco or vaping, too much salt, low potassium level, drinking too much alcohol. These all are the situation of the hypertension, risk of hypertension. A reduction in the heart pumping capacity leads to congestive heart failure. When there is the less contraction of the cardiac muscles, mainly ventricular chamber, then what happened? Less cardiac output, less blood supply. So that is called as the reduction in heart pumping capacity, where actually the systolic and diastolic pressure get disturbed, or CHF will be there, congestive heart failure, or simply known as the condition where heart is unable to pump the blood effectively. So CHF. Which lipoprotein is commonly referred to as the bad cholesterol? In our body, we have the different type of the lipoprotein like VLDL, very low density lipoprotein, IDL, intermediate density lipoprotein, high density lipoprotein, low density lipoprotein. Out of that, HDL is considered as the good cholesterol because it carried out the cholesterol from whole the body to the livers for their metabolism. So that's why it called as the good cholesterol. While LDL, that means low density lipoprotein, is known as the bad cholesterol because it take the cholesterol from liver to and deposit it to all the other parts of our body. So that's why that is called as the bad cholesterol. So here, high density lipoprotein, no. The correct answer will be the, according to the bad cholesterol, yes, low density lipoprotein. LDL, low density lipoprotein, sometimes called as the bad cholesterol because it build up cholesterol in different arteries or deposited in all over the body. So that's why bad cholesterol. Which of the following is a symptoms of the congestive heart failure? CHF, reduce blood supply. Chest pain, swelling in legs and feet, shortness of breath. Yes. So here all the situation can be there because basically start from the less cardiac supply or less blood supply to the organs. When the less blood supply to the organs, then there will be the pain, there will be the shortness of breath, there will be the swelling in the legs and yes, dyspnea, shortness of breath, contraction problem, concentration problem, exercise ability is hampered, swelling in ankle, leg and feet, irregular heartbeat and palpitation can be there after the CHF. So it should be the control. Emphysema is characterized by when there is in the lungs in the alveoli, there is the increase or enlargement of the air sacs due to the filling of the different type of the secretion or the liquid there. Enlargement of air space is called as the emphysema. So it mainly happened with the person who are having the smoking habit, or that condition can be worst. Emphysema is lower respiratory tract disease characterized by the abnormal permanent enlargement of lung air space with the destruction of the air wall without any fibrosis destruction in the parenchyma with the loss of elasticity. This is the normal alveoli, and this is the emphysema condition. So it should be the harmful for the patient. The most common allergen associated with the asthma. Most common allergen for the asthma, that may be pollens, that may be dust mite, that may be spores. Yes, all of these can be there for any asthmatic patient. If these type of allergen enter into the body, then actually it leads to the hypersensitivity reaction, and after that hypersensitivity reaction, there will be the release of the different type of inflammatory mediator will lead to the bronchoconstriction, and that can be the situation which can lead the asthmatic attack. Allergen exposure to allergen is major trigger of asthma. Common allergen, pollen, paint dust, dunder, dust mite, mold spores, all will be there. Which of the following is obstructive lung disease? Obstructive lung disease. Asthma, yes. In the asthma, obstruction happens in the bronchi, less oxygen supply. So asthma. Pneumos, no. The correct answer will be the asthma. Pulmonary fibrosis, yet it can be the COPD. Neuromuscular disorder, congestive cardiac failure, these are the restrictive lung disease, these are the obstructive lung disease. What we have the question? Obstruction. Yes, obstruction in the bronchi, obstruction in the lungs. So COPD, asthma, or we can say the cystic fibrosis, bronchiolitis, these are the asthmatic. What is an asthma attack? When the lung fill with water, when airways tighten and the lungs don't get enough air, when the heart beat too fast, when the heart and lungs are working too hard. No, no, no. Yes. When airway tighten and the lungs don't get enough air, so there will be the asthmatic attack. It may be by the various reason. It may be by the extracellular any stimuli, or it may be due to the intracellular stimuli. It can be any type of stimuli, maybe by any allergens. Which of the following is the leukotriene antagonist? Leukotriene are mainly responsible for the contraction of the bronchi. So during the asthma, we use the leukotriene receptor antagonist. Though two drugs are there, that means montelukast and zafirlukast. So both drugs are here. So correct answer will be the C. Yes, montelukast and zafirlukast both are the leukotriene receptor antagonist, and they are mainly used in asthma. Another word question also be there. Leukotriene synthesis inhibitor means LOX inhibitor, that will be the xylutone. So remember both drug, xylutone, LOX inhibitor, montelukast, zafirlukast, leukotriene receptor antagonist. Short acting beta agonist used in asthma. Short acting. There is two words, SABA and LABA. SABA means short acting beta 2 agonist, salbutamol, terbutaline, albuterol. These are the short acting. Long acting beta 2 agonist, salmeterol, formoterol. These are the bambuterol. These are the long acting. So here the correct answer will be the albuterol, because montelukast, that is the leukotriene receptor antagonist. Yes, fluticasone is corticosteroid. Cromolyn sodium, it's mast cell stabilizer. So correct answer will be the albuterol. These are the short acting beta 2 agonist. Medically speaking, breathlessness or being short of breath is called as breathlessness. Shortness of breath, that is called as the dyspnea. Yes, that is called as the dyspnea. Shortness of breath condition is called as the dyspnea. Shortness of breath, where medically as dyspnea is often. Drug used in the treatment of COPD, similar, bronchodilator. can we use there at the first choice? So bronchodilator, yes, we have the albuterol, but corticosteroid and eclidinium can also be there. So its correct answer will be the D. In the COPD, what we have the different type drug, bronchodilator, short acting as well as the long acting beta 2 agonist. Inhaled corticosteroid will be there, mucolytic, antibiotic, these all can be there used. COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Here, A answer will be there. So these are the important 30 questions from the introduction, CVS and respiratory under the pharmacotherapeutics. I hope you have understand all the question easily as well as their explanation. So if you like it, this series, continuously follow the channel. We are going to bring you the lot of the content totally free of cost in this YouTube channel. Thank you all. Thank you everyone.